We'll give it one more minute till we hit 105 for folks to join. We think we had some technical difficulties with the meeting invites not updating on people's calendars, which might have lowered our attendance this month. So thank you for everyone who is here, though. Okay, it looks like you got the recording started and it's 105, so we'll dive on in. Um, since we only have a couple people to here today, if you have questions, please jump in at any time. Happy to make this a little bit more of a conversational meeting. Otherwise, we have a whole bunch of updates to share, mostly about OHP Bridge, some of which we've been discussing at various community partner collaboratives and previous months of this office hour as well. So that'll be a refresher, though there's a lot of issues that have been happening. So just sorting out what's happening and sharing the updates on each of them has been helpful for folks to keep them all sorted out and separate. So um, with that, I'll dive right in. We'll start with some OHP updates today, starting with where to learn more about federal changes. We're not going to get too deep into what's happening there. Analysis is still happening on all these things since there's been so many changes in the last few weeks that have been announced on a federal level for future implementation. Then we're going to head into some updates, uh, talk about third-party liability a little bit more, and that'll lead us into one of our OHP Bridge updates about TPL cleanup. Um, we'll revisit the update on start date adjustments and letters that'll be going to members about that, and then close with the annual income lower limits issue that we discussed last month in this meeting, as well as the collaboratives, but more updates to come on that. So, um, wanted to reshare the Federal Response Planning Team webpage. If you haven't been to this webpage before, at the bottom, the OHA/pages federal changes thing link here at the bottom, that is where we store all of our materials about anything to do with response to federal changes to Medicaid programs or other actions that they're taking. This is going to be the main hub you want to go to if there's any change that you're looking for information about this. That has recently been updated with some more information about recent data privacy concerns that I'll get into on 2 slides from now. Main thing I wanted to share with partners today, though, was this invite to a webinar that's happening 2 weeks from today, specifically for partners about federal changes as an opportunity for you to submit questions. There's an option for you to submit questions in advance of this through this registration link as well. But this is going to be focused on all the federal changes. So if you have questions about the Medicaid bill, things that are happening with immigration, all those sorts of things, this is really the best channel for it. I'm not an expert on all these things, so we've got a bunch of other updates I'm happy to take questions about there. If you want to raise questions, I'm happy to at least try to direct things, but we don't have a lot of the answers at this moment, given that a lot of this is so recent. So this webinar is going to be the perfect venue, though, to get those questions answered, and then there's going to be repeat sessions coming up in every couple of months. So, or at least I think the next one planned for September or October. They're still settling the date, though, so we don't have the invite to share at the moment. Just wanted to make sure that you're aware of that. So if you have questions about the federal changes, this is the place to go to get those. We also did want to flag that there was an update to the federal response planning page, adding some information about a federal request for Oregon to provide data about people who benefit from federally funded services. Oregon's aware that other states had that. The federal government ended up sharing that data with the Department of Human Services or Homeland Security. Sorry, not different DHS. And there's concern that it may be used for immigration enforcement purposes. There's a whole lot of uncertainty about what's happening there still, as Oregon is, the Department of Justice has also announced that we're participating in a lawsuit to against block any misuse of federal data there. A lot of changes happening at the moment that we don't know the full answers to. Oregon has until the end of the month to respond to that request and is still determining whether it's going to do so and the legality of all of this. So more information to come 2 weeks down the road in that webinar. We should have more information and we'll share the latest updates about what's happening about all of that. This webpage has a statement, though, you can read the full details of about what we know at the moment. Otherwise, we've got a whole bunch of one system updates coming up this month that we wanted to share a little bit more about. First of which is no longer going to actually be in the July build. When we initially wrote these slides, this is going to be planned to have more languages added in July, but that's been delayed to September. nonetheless going to go ahead and share what's happening here. Um, Basically, the one system only knows a certain number of languages. Prior to this year, it only knew 7 languages, and when a member who preferred a language outside those 7 got a notice, it would first be sent in English while we sent the notice to translation. That way, we're giving the member prompt information that they could call in and translate if they needed it rapidly. But that translation process can take a couple weeks, and just the fact that we're individually translating each notice means that there's some inconsistency between how things get translated and whatnot. Um, Once that translation returns, though, we send that to the member in their preferred language. Basically, we are adding to that list of languages that the one system knows and going through and translating all the different possible permutations of how that letter can appear. That way we can actually deliver those notices to members in their preferred language right from the get-go. The We're going to be proceeding through all OHP member languages. So if we even have one member that has preferred that language, it will be on that list eventually. That we're going order down the list in order of how many members speak that language, essentially, or have marked that they preferred that language in one. So you as assisters, as you're filling these out, if members are reporting that they prefer that language, that data will get fed into our list, and we will continue to add these languages as to reach everyone who in Oregon. So earlier in 2025, we added a long list of languages here on the top bullet. Then we have 2 more updates planned for this year that unfortunately got delayed by 2 months. So Chuukese, Marshallese, Tigrinya, Pashto, Bosnian, Portuguese, and Lumian are now going to be the September wave of notices, adding those languages into the system. So once you see those, especially if you're an organization working with one of these communities, please let us know how that's going for members, and especially if you see anything odd in the translations themselves. Now that the one system has its own set translation of all of these different topics, we can adjust that and improve things, and would really value feedback on the content of the translations as well. And then in November, we have more languages planned, which are Mam, Kinyarwanda, Punjabi, Hmong, Japanese, Bengali, Saga Karen, and Turkish. And we'll continue communicating the schedule for new editions, which is going to continue happening roughly every 2 months. Though, like with how this got delayed, there can sometimes be some shifts about whether it makes it into the one system build or other competing priorities end up pushing things out a little bit. So that will continue through all of the 140-ish member languages that members have told us they prefer, though that's going to take years to complete. So well through 2026, we expect to continue to be working through this list. Otherwise, we have some other work processes coming up in July that are getting added, not all of which are going to be immediately visible to community partners, but we think we're worth knowing about anyway. Um, One of which is a new worker side process for pay stub uploads, which is going to be using an AI-based upload tool to automate the upload of the kind of information extraction from pay stubs. So it's kind of like a Scantron type thing that's going to read the scans of the pay stubs that come in to OHP when people send in proof of income and things like that. And it's going to try to port that information over into the one system and display a side-by-side view for workers in order to verify the accuracy of that information before it actually gets put into one, but still speed up the process of doing that. That is going to make the clarity of documents, like the visual clarity of scans and whatnot, all the more important. Already, there's always possibilities that some scans become unreadable and we just can't figure out what the information is, and it results in that not being provided to the system, and maybe the member getting a notice that they didn't respond because we couldn't figure out who it pertained to, things like that. With this new automated process, it's going to be all the more important to make sure that those documents are as legible as possible and using resolution high enough to make sure that we can actually read the text on them and whatnot. So just a reminder there, but also a flag for you that this is how many data pay stubs will be processed going forward. If you're seeing things like that, it can be helpful to know and talk through that with the workers potentially. So wanted to make sure you're all aware of this. Otherwise, another smaller change that's coming in July is adding a unearned income screen comment field, specifically under the other income taxable and other income non-taxable options in one. We're going to add a comment field there specifically so when people have paid leave Oregon, um, That way we can denote the type of medical leave. We need to know whether it's family or medical types of paid leave. Paid Leave Oregon's the program that we all pay into where you get paid leave essentially, but that can take multiple forms depending on whether you're caring for family or have a medical issue there. So those are the ones that we added it for. Though for other types of income, entering the best description of the income source is going to be the guidance going forward. Got a couple screenshots here of how that looks. This is the unearned income selection screen from the main income screens. You'd want to select this first, and then it'll take you to the unearned income options. Out of the drop down here, you'd select other income and then other income taxable. And then this, which type of income is this field here is where you would enter either family leave if it's the family type of paid leave Oregon or medical leave if not. If it's a different type of other income besides paid leave Oregon, then just note what it is as best you can in that field. Hopefully a pretty simple change, but for people with paid leave Oregon, that's going to be relevant to how to enter things properly. And then the last of the policy updates we wanted to share here leads us into our OHP Bridge ones. But last month we shared some updated TPL guidance on the process for community partners to tell us about other health insurance. So when we say TPL, that refers to third-party liability, which is our fancy term for other health coverage. There are two systems that information needs to make it to. First is the one system, which needs TPL information in order to determine program eligibility. OHP Bridge, for instance, isn't going to let you have other affordable health insurance through an employer. One system needs the TPL information in order to correctly decide whether that person is eligible for OHP Bridge, for instance. Children's health insurance programs based on Medicare, a lot of programs need these things too. Then that information gets sent over to the Medicaid Management Information System, otherwise known as MMIS, which y'all's sisters may be familiar with using it for status checks, but it's also used for CCO assignment and all of the logistics of paying bills through OHP. So all the claims go through there too. Unfortunately, the information when sent from the one system over to MMIS is taking more than 2 months to get entered at the moment. So we've been asked to share some guidance with partners to please submit that TPL info into both the one online system as well as go to reporttpl.org and use the web form on that site to add the information there as well, which will get it into MMIS faster. It's apparently still taking close to 2 months there, but shaves about a month off the average time to get entered there. If you have a case, though, where there's going to be urgent issues, for instance, somebody has some old records in MMIS that are preventing them from getting assigned to a CCO, or one of the programs that doesn't allow other coverage might be closing, calling the health insurance group team there, that 503-378-6233 number, that's how you can get an urgent case expedited to make sure they're able to get assigned into a CCO in time to meet their care needs or whatever the urgent effect on their actual healthcare is going to be. So that's the new process there. Please submit it to both systems, even though we understand that's creating duplicate work for both the assister and the staff that receive these. But in order to make sure that this is going at a reasonable pace, we wanted to get this into both systems going forward. If you haven't been to reporttpl.org before, if you've been around a while as an assister, you might remember the site. We've gone back and forth on whether or not to use it in addition to the one system. Now we're going back to please use this in addition. If you haven't been to that site, go to reporttpl.org as your starting place, and then in the middle of the page, there will be that add, update, or remove TPL section with the green button. You'll want to click that, and that takes you to the web form itself. The first page of which is going to ask you to enter your assister information and basically just identify yourself. Fill it out for yourself as an assister, and then when you click to page 2, that's going to be the information about the policy holder, and the OHP client that it pertains to. So you'll want to get all that information entered in there and then mark the policy as either active if you're adding one or terminated to remove it. That system also lets you apply for help paying health insurance premiums, which is a pretty little known program we have, where if somebody's employer coverage is costing them something out of their paycheck each month, in some cases it's financially effective for the state to pay that for them. That way we can bill most of their services to their private insurance, and it's cheaper for us to pay that private insurance premium than potentially have them drop it due to cost. So this system also allows you to pay for that as well, or to apply for that as well. Pretty simple system. It takes a couple minutes to get this entered each time. Click through it real fast and then attach any notes you want to, get it submitted, and then that'll go to the health insurance group team faster. And final step would, if you have an urgent case, would be to call in and get that expedited with them. So moving along to OHP Bridge, I put the TPL guidance section right next to that because, or right next to our first item for OHP Bridge because we've got some changes related to TPL in there. But before then, just wanted to give a quick rundown again on what OHP Bridge is. It's our new benefit for adults with higher income. People with OHP Bridge need to be between 133 and 200% of the poverty level, which I'm realizing I need to update this slide still. They need to be between 19 and 64 years old, not have other affordable health insurance, and have an eligible citizenship or immigration status to qualify. Benefits-wise, OHP Bridge is basically identical to OHP Plus. It's free coverage, no copays or deductibles. The only benefits difference is that it doesn't have the option for people to get long-term services and supports or the new health-related social needs, climate, food, and cooling benefits. Those are the only exceptions and differences between OHP Bridge and OHP Plus benefits-wise. So this slide is pretty redundant of what I just went through, but we are going to be embarking on a cleanup effort going forward to make sure people who have OHP Bridge don't have information on file in MMIS that might be out of date. So OHP Bridge members can't have other health coverage, so we need to make sure that the information, it's particularly important for these members that the information in the one system and MMIS matches. We've got about 1,500 cases we found that have other health coverage on file in MMIS, but not in the one system, which indicates that they didn't tell us about it at their last application. That might mean it's out of date. Strong possibility that a lot of these are, though it might be inaccurate information that we base the determination on as well. Like they forgot to enter the correct information and might have got OHP Bridge erroneously. So our staff need to work through these. It's going to be a slow process taking place over months, and then ongoing. We will continue this as new members have TPL identified. It's going to be an ongoing process just to kind of maintain and clean up the program. Once we identify someone who has other health insurance information on file in MMIS and has OHP Bridge, they will get an outreach call from an eligibility worker to try to update the information first. Then if that eligibility worker call is not able to reach them, we would send them a notice, like a request for information, asking for their missing health insurance information. Then if they didn't respond to the paper notice, after the duration, it can be the duration they have to respond can vary a little bit. But once they miss that deadline, then they would receive a notice closing their OHP Bridge benefits. So the goals of this effort here are to remove outdated policies from MMIS. A lot of it will just be cleanup if it's out of date. If it is still a valid policy, though, we need to get that information added to one, and then collect the information and run the employer coverage affordability test for OHP Bridge. So we don't allow you to have other affordable health insurance through an employer. We need to figure out whether or not any employer coverage is deemed affordable there. And then if you do have an affordable employer coverage policy or have Medicare, for instance, then we would actually need to close their OHP Bridge. So for partners, this is going to be pretty simple. It's just going to be responding to requests that members receive, like any other member. If they get a request from us, please help them respond to it. It'll specify the information that they need to provide in the notice. Also, just a general reminder to please pay particular attention to entering TPL info when applying and continue to remind and help members report changes. That way we get accurate determinations at the first time they apply for OHP Bridge when possible. Or if they do have changes in health insurance, promptly tell us about those. On this slide, we got a little flow chart of how this is going to work. Starting on the top left, once TPL is identified in MMIS, we're going to first do that outreach call and then send a request for information. If they don't respond to us during that process, then we would move on to, so if they don't respond to us at all, we would move to closure based on non-response. Otherwise, if they do respond, they head down the right path. And our first question becomes, is coverage still active? If the coverage is still active, we just need to get it removed and they're able to keep their OHP bridge now that we've got the system cleaned up. If the coverage is active and is both employer sponsored and affordable, they would end due to the having affordable employer sponsored coverage. Otherwise, if it's either not employer sponsored or not affordable, OHP Bridge is going to just continue with the accurate health insurance information on file for them. So out of that 1,500, we expect a lot of them to continue. Some of them to close due to non-response, and some of them to end due to having affordable employer coverage that we didn't know about. So that's what's happening there. Should be a pretty simple cleanup effort. Do have a couple screenshots of how the TPL screens in one are appearing now. This is the other health insurance record for a member. If you select that the person does, it'll ask you what type of coverage that is and give you the drop down where you can select the different types of policies. Insurance through employer includes at least doctor's visits and prescriptions is going to be the main one you'd use for anyone with employer coverage. If they're buying a plan through the marketplace or direct from a health insurance company or something like that, they would instead use this private policy on the top there, which would not apply the affordability test. If you do select the insurance through employer, doctor's visits and prescriptions option, here it brings up this section in the page where it will ask you for whether or not this coverage provides coverage for hospital visits, which is a proxy for is it minimum essential coverage and meets the requirements to count as health insurance at all. And then it's going to ask you how much it pays in premiums. This is the information we need to get collected for these members in order to determine whether or not any affordability employer plans are affordable. It compares it to basically 9.02% of their gross income. If the plan is cheaper than that, it's considered affordable. If it's going to be more expensive, which includes the prices for like family plans and whatnot, they get treated at full value. Now, those can be expensive, for instance. Um, if it's above 9% of their income, it's not considered affordable and they're still eligible for OHP Bridge in those situations. So getting this section is really important, filled out correctly is really important for any OHP Bridge member or people in that income range. This is the part that we're going to need to get any information into over from MOIS if it is an active plan. Okay, so that's the TPL issue we've got to share there. Unless there's any questions, it doesn't look like I've seen any pop up in chat or hands raised yet. I'm going to move along to our other couple issues that we got. So sharing this slide is a reminder about how start dates work for OHP Bridge. Specifically for all the members that are not American Indian or Alaska Native are going to have these future effective start dates where rather than like OHP starting at the beginning of the month that you applied in, it's always going to give you a future start date that's either at least 2 weeks out from when you applied. So if someone applies in the first half of the month in the orange parts of this chart, their coverage starts on the first of the next month. So if someone applies in the first half of October, they get a November 1st start date. If they instead apply in the second half of any month, it gives them the first of the month following that next month. So late October produces a December 1st start date instead. That's going to get important for both of the next changes we're going to talk about here. First of which is start date adjustments. So we received federal approval about an issue we previously shared in this meeting. We presented this back in April. We were thinking it was going to happen sooner, but we just received the federal approval to begin moving forward with the start date adjustments for people who had a coverage gap after moving from the marketplace over to OHP Bridge, specifically during open enrollment season. So members are going to be able to request an adjustment to the start dates to move their OHP Bridge start date back to the first of the year, kind of lining it up with when their marketplace coverage ended. That way they didn't have a gap in coverage when moving between the two programs. We expect about 1,500 members are going to get this option for this year, and we'll get a notice in September about that option to request the start date adjustment. And then keep an eye out for members who are experiencing a similar coverage gap next open enrollment as well, as this is going to be relevant for next year too, which is coming up quite soon. So here's a little visual of how this coverage gap works. Basically, if someone applies for health coverage on healthcare.gov, like updates their marketplace account for the year as you're supposed to, um, if they do that in the beginning of December, that will start a 45-day review period for us to complete the processing of their application by the end of, or that goes through the late January. That's our timeline just to process the application, not to actually assign the start date. Based on this end of 45-day review period in late January, they might end up with a March 1st start date of their OHP bridge based on that. And that would be what we'd expect. However, that leaves them with a 2-month gap in coverage, which we've got in the purple on this graph. Due to healthcare.gov ending benefits on December 31st/January 1st, and not because healthcare.gov isn't going to let people re-enroll into the next plan year if it thinks they're not eligible anymore. But unfortunately, we're still deciding at that time, so their coverage ends as of January 1st, and they end up uninsured until OHP Bridge starts on March 1st. By contacting us to request that start date adjustment, though, we would move their start date back to January 1st, and that would make any bills that they received during that January 1st to March 1st time eligible to get paid by OHP Bridge. And that's the real goal here, is to make sure any services they receive during that gap due to the system interactions, we could potentially provide coverage and get their services paid during that time. This is only going to be available during open enrollment seasons, though, due to how the system works there. The marketplace will generally let you continue on plans if you're applying outside of open enrollment, but not with the new calendar year of coverage. So how those rules interact there. We wanted to offer this option to members. So starting in September 2025, the members who are affected by this are going to be able to get those start dates moved. Contacting one customer service or the CP assistance team is going to be the route to do so. They'll do a little override process to move that start date back to the first of the year. Then the next step is going to be contacting, like once the start dates have already been moved, then contact the providers they saw to rebill the services that were received during the gap. Only the member is necessarily going to know about where all those services were since they weren't an OHP member at the time. A lot of that's going to be on the member to know where the services were received, who's sending them bills. But once they have their OHP open for the days of service, they can get those bills sent in to the OHP by just contacting the provider and telling them to rebill, provide them their OHP ID number if they didn't already. For the moment, though, plan to reconnect with any affected members that you flag that they're in this gap in September. And then for next open enrollment season, we'll have this available. So as people experience it, we can begin requesting those start date adjustments on the spot. So got it set up for next year. The people who are specifically eligible for these start date adjustments are people who apply between November 1st and January 1st. It's the first 2 months of open enrollment season, and then end up with an OHP Bridge start date of February, March, or April 1st, which we would then move back to the January 1st date so they didn't have a gap in coverage. They do have to be enrolled in the marketplace coverage in the previous year, so we're not going to adjust this if you didn't have coverage at all prior to that. It's only if were actually on marketplace. And you do actually need to have medical bills in that gap. If there's no services in that time, we're not going to pay the CCO for your coverage. That's not going to provide the member any benefit. Got a couple examples of the notices that'll be going to members in July. We'll try to get these into a PDF file that's shareable in other contexts as well, with the Spanish versions and whatnot as well. In the meantime, we have the or the mock-up text here, which is very similar to the text we shared on the previous slides, basically running through that they had a gap in the health insurance after moving from healthcare.gov to OHP Bridge. Then they have that option to move their start date forward and cover bills during that time. If they want to do that, they end up with 2 steps, which is contacting them they're going to have 60 days to do so, and starting in September, to move their start date. Tell them all you need to really do is say that you had medical bills and a gap in coverage during that time. They'll be able to move that start date forward. They may ask some additional details about the marketplace plan, but in general, it's going to go off of the member attesting that they had a marketplace plan and the gap in coverage. And then once those start dates are moved, contact healthcare providers that have been sending you any bills or that you received any services at. Provide them your OHP ID number, tell them your start date changed, and they'll get the bills submitted to the community care organization, coordinated care organization. There are some cases, though, where providers may not be able to rebill services to OHP Bridge. Specifically, pharmacy bills don't allow rebilling after a week in general. And same goes for providers that were not in network with OHP at all. We wouldn't be able to get those rebilled in. So we do provide that caveat as well in the notice to members. Um, the ways for a member to get help besides a community partner would be to call the CCO and ask for help resubmitting bills, or if they don't know their CCO, OHP Client Services can also assist with that. So that's the notice they'll be getting in September. About 1,500 members, about 5% of OHP Bridge members total, will be getting that notice, and then we expect this will be relevant to just as many people, or similar numbers at least, in next open enrollment season. So keep an eye out for that as we go through open enrollment, and we'll share more reminders about this as we get into open enrollment season. So that's only a couple months, a few months off at this point. Okay. Please chime in if you have any questions at any point. Otherwise, we'll keep on moving. There was also just a minor update about self-employment income that we corrected, where OHP Bridge wasn't counting self-employment income or the expenses as negative income, and a few members were incorrectly denied for being over income when they shouldn't. About 80 cases were affected by that and were revised in the June 11th one system update. We did some reevaluations in the week after that, and new notices went out to any members where the determination changed. If you have any questions about that, you can always contact Community Partner Access Line and see if your case got reevaluated or anything like that. But that should all be fixed, and we really appreciate the partners that flagged this unexpected outcome for these members and got it fixed for us. So thank you to anyone who provides feedback to us. Otherwise, the last issue for OHP Bridge and for office hours today is going to be the annual income lower limit, which we shared a little bit about last month and have some updates on. So that's a policy correction where previously one was approving anyone below 200% of the poverty level for OHP Bridge, including people between 100 to 133% of the poverty level on an annual basis, who should be who should be referred to the health insurance marketplace instead. So going forward, OHP Bridge is only going to be available to people who have annual income between 133 to 200% of the poverty level, as well as they need to be above the OHP monthly limits too. So one clarification there, though, is that since that 100 to 133% range is lower than the monthly income range of below 138% of the poverty level, this basically means this only affects people who have variable incomes or have only had their job for a part of a year. Since you have to be below 138% monthly, but then your annual needs to fall in the 100 to 133% range annually in order to be affected by this. We just got the community partner income guides updated. Those are the same addresses as you have been using, so it should take you right to the new versions on those. Or searching community partner income guide on Google will also bring it up. Happy to drop the link in the chat at the end of the meeting. So this slide shows how the annual income charts stack up. So for eligibility, the first process is always going to be to check if someone is over the 138% monthly limit for OHP's programs based on monthly income. Once they have been denied for the monthly income programs, we start looking at their annual. If their annual is below 100% of the poverty level, they qualify for OHP Plus based on the 100% annual income test. So their annual income can qualify them for OHP using that lower number. If they're in the range between 100 to 133% of the poverty level, unfortunately, neither OHP Bridge nor OHP can cover them. The marketplace is the only available option for people in that group, though they will get really significant financial assistance like the tax credits and cost sharing reductions that cut their copays and deductible costs quite significantly. So they'll get help from the marketplace, but unfortunately, people in this income range do not have the option for OHP Bridge. OHP Bridge going forward is limited to the 133 to 200% range, with that lower boundary being the new information here. And then unchanged from before, if you're above 200% of the poverty level, you're not eligible for the marketplace at all. Or sorry, you're not eligible for OHP Bridge and would be referred to the marketplace. Just a second here, my computer cord came unplugged. Okay, technical issues repair. Looks like we have a chat here. Oh, thank you for sharing that FPL chart. Um, as Christina just shared, there was the FPL charts, but we're going to move on to the example versions of this. So we only have a couple of people here in there, so let's actually do this as a quiz style thing. This in this example, Laszlo is a single adult who was unemployed for part of the year. The first 3 months didn't have a job, and then starts a job in April, a month before his. That gives him 9 months of income. For income projection for 5 would be 18,000. The first thing it's going to check is monthly income quality, and then if it doesn't qualify for the monthly programs, it would look at his annual. What does Leslie qualify for 2025? Would love it if either of our attendees are feeling to give this a try. Sorry to put you all on the spot. Happens with two people here.
Sean, I should warn you, you froze a little bit
Oh no.
when you were posing the question, and I'm not sure if we got all of it.
Yeah, so I'll try to repeat that then. I'm not sure what part cut out. Uh, so question here is, what does Laszlo qualify for? How is the eligibility going to work for him? He's a single adult who did not have a job for the first part of the year and then expects to have 9 months of income, earning $2,000 a month when he applies. So his monthly income is $2,000 a month, but his annual income projection for the year is going to be $18,000. Which program does he qualify for?
I see some responses coming in the chat.
Let me open that up. And yes, he does fall into the marketplace category. So we'd compare his $2,000 a month income to the OHP plus single adult limit here on the right, and then find that he ends up in the 18,000. He's going to be too high for OHP plus and get that denial reason in his letter, and too low income for OHP bridge and get that denial reason in his letter as well. Then his case gets sent over to the marketplace. Second variant of this example, though, is if Lazo continues his job into 2026 at that same $2,000 a month rate, that would be $24,000 for the year. What does he qualify for next year?
Comments coming in the chat saying OHP Bridge.
That is correct. He's back up into OHP Bridge. This kind of illustrates that a lot of this is going to affect people who have partial years of income. If he reapplies in December 2025, it's going to start considering as 2026 income. He's probably going to be eligible for 2026. So if he goes through the marketplace this year, telling them to reapply and back come December would probably be the best advice for someone in this situation. And that's going to happen a lot with people who are affected by this, is they're often going to qualify in the not too distant future. Third iteration of this example, if his $18,000 a year annual income instead remained consistent into 2026, or just expected that to be an ongoing amount, what would that qualify for him if he's going to have that instead average 1,500 monthly, which is 18,000 to divide by 12? And yes, it goes back to OHP plus in that situation. So if you're in this income range to be affected by this ongoing, you probably qualify for OHP plus in your low months of income at least. Telling people to report changes diligently or reapply for OHP plus in those low months is often going to get people out of the situation as well and onto OHP. And then with our continuous eligibility rules, we'll lock in your OHP eligibility for 2 years, regardless of the income changes. So a lot of ways to get around this with the client if you're able to figure out when they're going to qualify, not in the future, for instance. So looks like folks are understanding. Glad to hear that. We'll move along to what's happening next. So there was a defect discovered in how the OHP bridge system implementation worked. The rules always should have been like this and had that lower income limit boundary on it, but unfortunately that was not how it was implemented. That was missed in the design, unfortunately. Getting that corrected though, but unfortunately the whole thing stems from basically funding rules. There are funds available for basic health programs to cover their members, but they can only be used for people between 133 to 200% of the poverty level. And the rules kind of assume that the other program, in this case Medicaid, would cover them, but the Medicaid rules instead use monthly income definitions and think that the marketplace is going to be covering this group. So we're left with a gap where we're unable to use funds towards people in this annual income range. As a result, we needed to take 2 steps to get it fixed. First of which was just updating the system to stop any new enrollments. We did that back on June 11th. And then the second phase is coming up tomorrow, where the one system is going to check if the current members continue to qualify. If they're still in this income range and still above the monthly income limit for OHP Plus, they're going to get a closure notice and be sent to the marketplace. If they're in the same range, they also got a text message earlier this week reminding them to update their income. It didn't really tell them anything else about this policy change, but we wanted to give one reminder to update income to hopefully avert some people falling into this at all. So after the data fix happens tomorrow, affected members are going to be mailed notices the following day that their benefits are ending on July 31st. Members are then going to need to take 2 steps, first of which is reviewing all the information on the notice that we use to decide their eligibility, particularly monthly and annual income information. If anything's different from that, reporting changes or reapplying, contacting eligibility one way or another is going to be the best option for them, or the first option for that first step for them. Otherwise, if they are losing benefits, going to the health insurance marketplace is going to be their next step, ideally before their OHP Bridge benefits end, in which case their marketplace can start the next day and prevent any gap in health coverage. Otherwise, they're going to get a special enrollment period to enroll, so they're going to be able to get into the marketplace outside of open enrollment season without worrying about that. They both get a 2-month special enrollment period based on losing OHP, as well as a special enrollment period for being below 150% of the poverty level. So they've kind of got 2 layers here to be able to get into the marketplace outside of open enrollment season. And anyone on OHP Bridge should meet the eligibility rules for tax credits on the marketplace side as well and get those pretty substantial tax credits and cost sharing reductions if they pick a silver plan. So first step, update with us, which may need to be a reapplication, unfortunately. And then if you are losing coverage, go to the marketplace next. They're going to have a really limited time frame of about 20 days to take all these actions. So the first step of our member communication on this was actually a message on Monday that was sent in advance of any of the system action to hopefully get some members to update their income in the last few days. We sent a very generic message about keeping annual and monthly income up to date. Hopefully some members took action in response to that and maybe would have removed themselves from this group of people that we expect to lose coverage. Hopefully that happened for some of them. If not, we have a few follow-up steps happening to help more of these members retain coverage. We also got a request for notice or example notice text here. Sorry, do I have these out of order? I'm missing one slide here. The first page of this, just a second. I'm going to drop out a screen share and get this fixed real quick and drop that back in. Let me show off the notice itself. I'll add this slide to the deck we send out afterwards. That's the other one. Thanks for bearing with me. I had both pages ready for this, but I'm not sure what I did with them.
See, why you look
Annual
for that
income
if,
gap. There we go.
I was gonna say, while you look for that, if you want to find it, I can also share it just kind of because I know that it's been hot and I just wanted to share some kind of heat resources too. So I'll just drop those in the chat. But okay, I see you have your thing up. So I just wanted to let you know, all know that I did drop those heat related kind of resources from OHA into the chat.
Thanks. Yeah. So here's the first page of that notice that I somehow didn't get into the chat. I think I accidentally overwrote it with the previous slide. So the page 1 summary of the notice is going to have a relatively within the scope of this very complicated change. Simple explanation of this, which is that people are getting this notice because they're over the monthly income limit for OHP and below the limit for OHP Bridge. Their OHP Bridge benefits are ending on July 31st. They need to take those two steps, which are basically identical to the text we just had on the previous slide, to review the annual and monthly income information, report changes but before July 31st. Hopefully, if anything has changed, they'll be able to keep OHP Bridge. Unfortunately, this text is a little bit out of date with some of the quirks I'll share on the next slide and was not able to be updated in time. This is still more or less accurate that they need to report changes, though. The method may need to be a reapplication is the only thing that became inaccurate there. Otherwise, the second step is going to be applying for the health insurance marketplace. They get 60 days from when their OHP Bridge ends. We encourage them to go faster than that in order to hopefully prevent long periods without coverage. Otherwise, they don't need to do any of that if they're able to keep OHP or OHP Bridge, though. The second page of the notice is the household member summary, which is going to have this is what our notices look like before they get the fields populated from the individual member's case. It will contain a note that they're below the income limit for OHP Bridge, as well as over income for Magi Adult, which is our main program for OHP adults. These are going to be very confusing notices as a result of the whole you are over and under income thing, but this is what members will be receiving if they're affected by this, and they'll be going out tomorrow. Let me hop back to the slide deck real quick. So, range of possible outcomes for members. Default path here, if they're affected by this, is that they're no longer going to be eligible for benefits and just be sent to the marketplace. They will still need to take action on the marketplace plan or marketplace side of things to click through the application, sign the agreements, and then select a marketplace plan in order to actually make the enrollment happen. Otherwise, if they're able to move to, or otherwise, the other two paths are reporting changes to us in some form or fashion. If they're going to be eligible for OHP again, such as their monthly income dropping below the monthly limit, or the annual income below the 100% poverty limit, or becoming pregnant or qualifying for young adults with special healthcare needs, they may be able to just report a change or reapply and get their OHP picking up exactly as their OHP Bridge ends. That one will go fairly smoothly if they're eligible for OHP again. If they're eligible for OHP Bridge again, though, the One System's quirk of not allowing changes to be reported while in closure mode makes things a bit more complicated. If they are very, very quickly able to respond, or they're able to get help from a community partner to respond prior to July 15th, that would make members who are eligible for OHP Bridge again continue OHP Bridge without any interruption. Otherwise, if it's after July 15th, the One System treating these as a new application means those OHP Bridge start date rules I shared earlier are going to apply, meaning that a new application in the second half of July is going to give them a September 1st start date rather than letting them start in August. That means these members would have a 1-month gap in benefits where they might, like before their OHP Bridge restarts, where they might want to apply for the marketplace for that single month. I understand deductibles mean that's not ideal, but for people with high enough healthcare costs, it could be absolutely worth it to cover our medication for that month or something like that, compared to going uninsured and having to pay full price. There's a lot of work that will be required for people in that situation. They need to close their marketplace coverage after their OHP Bridge has started again, but that is a legitimate option for people in that situation, though we want to try to get those changes reported prior to July 15th at all possible in order to keep as many of these people covered without a gap if they're eligible to continue. Thank you to the partners who helped realize that quirk of the system there. In response to that, we both added that text message I referred to that went out earlier this week to hopefully get more of these incomes updated in advance of July 15th and therefore prevent these gaps. We are similarly just started communicating out the list of affected members, or at least I've sent the first of them to the regional outreach coordinators earlier today, and then those will be going out from the regional outreach coordinators to the believe it's 98 of community partner organizations across the state have an affected member. It's fairly low numbers per organization. Most of them have low single digits. I think the largest organization has 20 members at most. Most of them are in that 5 or less range, though. If you get a list from us this week and have the capacity to do so, please reach out to the affected members to help them report any changes, explain this issue best you can, and reapply as soon. If they, I say rally on that slide, it should be reapply, or reapply as soon as possible. So once that closure has been scheduled, a lot of the changes reported will actually need to take the form of reapplying, like the system is going to make you click fully through the application. Otherwise, if you have the capacity to do those changes prior to July 15th, that's going to prevent those interruptions in coverage for members who become eligible for OHP Bridge again. So that's ideal, but also anytime, the sooner the better. Replying after the deadlines is still better than not doing so at all. The CPD focus team has been trained on this. They're ready to help with eligibility as needed, especially with the review timelines of trying to beat that July 15th deadline. We want to, if the change reports go into worker review or the reapplication goes into worker review, contacting the CP focus team for help expediting that can make this go smoothly for members as well. And then once members have received a notice that they're losing benefits, which may include reapplying and seeing that they are not eligible, basically once we know that they're going to be losing benefits, help them move to the health insurance marketplace or refer them to an agent or broker who can help them with that step. If you haven't seen a list from us by the end of this week, your organization doesn't have any. Otherwise, we will have those coming momentarily from our regional outreach coordinators, and any rocks on the call, you should be seeing those from me over the course of today and tomorrow morning. Okay, that is it for the topics here. I also got one question that I wanted to do a quick demo on, which is the how to set up the window shopping tool for people who are affected by this issue here. While I do that, Christina, you sounded like you wanted to talk about the warming resources really briefly. Good moment for that.
Yes, sorry. I had just dropped in that because I know we talked about it during our collaboratives this morning, but just because it's been kind of hot recently and it looks like it's still going to be a little bit, we're going to have some high temperatures kind of off and on throughout the week. So just wanted to share some, I posted a link in the chat for some heat related resources. So there's a lot of communications on this website that I posted. So it's the preparedness, so prepare for extreme heat. And I think the one that I joined, so you should be able to get links for different documents, but one of the ones that I like, there's stuff that you can kind of like post on, like if your organization uses like social media platforms and you'd like to share it, but it has like information about like heat stroke versus heat illness. Oh yes, thank you, that graphic. So just kind of wanted to share that because it's been hot, and then it's probably going to continue to be hot, and then obviously we're just starting with summer, so just some resources for you all.
Yeah. Okay. And then the last thing we're going to do today is going to be showing off how to set up the report or the window shop tool. That's the name of it. For someone who's affected by that annual income lower limit issue. So OregonHealthcare.gov/window shop will take you to that page. This is the eligibility estimator tool we have. If you then, sorry, this is in the way for me. Throw in a zip code. And it'll take you to this main page, which is the coverage profile. If you scroll down to the bottom of this page, there's going to be this Access NAV mode button down at the bottom. Navigator, or NAV means navigator here, or which is another term for assister on a federal level. If you click that button, it's going to bring up some assister specific options here, one of which is to mark someone as not eligible for Medicaid or BHP, which is Basic Health Program, first OHP Bridge. So this basically lets you prevent the system from referring someone back to OHP. This whole system is only going to be based on annual income, so it doesn't actually run all of the calculations we're describing of monthly income first, then annual income. This is really just an estimator tool that points you to the first place to start. Since someone who's in this annual income gap is quite likely to have a monthly income gap, a monthly income that might qualify them for OHP plus, the system's going to keep referring them to OHP plus as the first place to start, which is a decision we agree with. For assisters like yourself who know the nuances of these rules, if you need to quote prices for somebody in here, clicking this Medicaid, BHP, and eligible button is going to be the best way to do that in this system. Then you can fill in the rest of their information. So 30-year-old, not pregnant, American Indian, not using tobacco, no employer coverage affordable offered to them. And then you can put in their income. So we can do that same $18,000 amount that we use as Laszlo's example, for instance, and estimate financial assistance. And it'll produce a tax credit amount of $530 a month in this case. So that Medicaid, BHP, ineligible button overrides this otherwise send you back to OHP in that situation. Then you can click through the next step and it'll take you to the actual marketplace prices, which many of these people in this situation are going to get similar prices to this, where they have a $1 premium, $100 deductible for a silver plan paying 94% of their healthcare costs, which is as good as it gets on the marketplace. So that's how to set up the quote tool. If you need to quote prices for someone over the phone or something, this is the easiest system to do it in. If you, hopefully that's helpful for people, well, assisting some of these people who are going to be affected by this issue soon. Other than that, that is the end of our updates presentation. Just wanted to open the floor for questions or discussion time. Got a pretty small group together, so if you have any questions, we've got the time to have a conversation.
Not all at once.
Otherwise, thanks for listening to a full hour of policy updates. I'm sure that's bewildered some people. My brain tends to glaze over at the end of these things, so I totally understand if now's not the time. That if questions come to mind in the near future or something, please reach out to us and we'll get you an answer. Oh, glad to hear it was easy to understand relatively within the scope of how complicated all this is. That's our goal here.
Sean, I'm wondering, is it are you able to send out a reminder before this meeting? Because it's not on like the calendar for group site, and I think a lot of people might have forgotten about it.
Yeah, especially we just extended the meeting series and that didn't extend the meeting invites for people who already did so. I definitely need to, I should have sent out a reminder about this before this meeting, and that was I will do so before next month because we definitely saw the attendance difference as a result of not doing it.
Yeah. And I think that's a good reminder because I don't think we had been putting this one on the group site calendar. So maybe we can add it there to the Spanish version too. So thank you for that reminder, Susan.